I want to start with a story. A 60-year-old kid from Long Island walks onto the stage of America's Got Talent. He's nervous. You can see it. He opens his mouth, and within seconds, the entire audience is on their feet. The judges are stunned, and one of them hits the golden buzzer. What the audience didn't know, and what was this moment extraordinary, is that 2 years earlier, this kid couldn't see the stage he was standing on. Christian Guardino was born with a single error, not a trauma, not an accident, but one faulty instruction written into his DNA before it took his first breath. This error, this broken gene, was slowly destroying his photoreceptors, and he was going blind. At 13, he entered in a clinical trial. The scientists engineered a biological vehicle, a modified viral vector, to carry the correct version of his gene directly into his retina cells. One injection, right address, right payload. His vision came back to 90%. After the treatment, Christian said something I have never forgotten. I saw the moon for the first time, the stars, the snow falling. I can't take any of those things for granted. This talk is called Keeping the Human in Life, not just alive. Alive means the heartbeat. Life means the moon, a snowflake, a stage. The difference is everything. What happened to Christian is not a miracle, it's engineering. And to understand why it changes everything, I need to give you the framework that completely rewired about medicine. The human body had 37 trillion components. Each one runs its own operating system. They communicate in real time, self-repair, self-replicate for 90 years if the code is clean. DNA is that code, 3 billion of base pairs, an instruction set that builds you from a single cell and runs you for the lifetime. For most of human history, we could read part of that code. We could observe it, but we couldn't touch it or fix it. When there was a bug, like Christian RPE65 mutation, all we could do was to manage the consequences, to slow the damage, to patch the interface. But never touch the source. That has irreversibly changed. We are not at the beginning of one innovation. We are at the convergence of three, and together they make the medicine of the last 2 centuries look like alchemy. So let me take you inside each one. There are 3 bets, I believe, will define the next 30 years of human health. The gene therapy. Christian's story is gene therapy at its most elegant, bringing back his sight. You identify the faulty instruction, you build the vector, a modified virus stripped with everything harmful, and use it to deliver the correct gene, exactly to the right cells. I spent years working on this approach for retinal diseases specifically. And what I learned is that the science is almost poetic. You're not flooding the body with a molecule. You're writing one correct sentence into a cell that had a typo. But the engineering is brutal. The targeting must be super specific, and the manufacturing is very complex. These are not biology questions. These are system precision engineering questions. Gene therapy fixes one instruction in one gene, in one tissue. What if the damage is already gone and the cells are already gone? The second revolution is more radical. It reprograms the cells themselves. We talk about CAR T cells. We extract immune cells from the patient. We reprogram them in the lab to recognize the specific target as a cancer, as a tumor, and then we reinfuse them to the patient. You are not giving to the patient a drug. You're giving a living and self-replicating army with a superpower personalized to their own biology. Some patients with terminal leukemia who has exhausted every option went into complete remission. The cancer was not managed or slowed down, just gone. And there are these iPSC-induced pluripotent stem cells. We take a skin cell, yours, mine, and we reverse it to a pluripotent stage. And it becomes any cell in the body, a neuron, a muscular cell, or a photoreceptor. We can build in a lab a model of your liver, of your kidney, and test whether a specific drug will work for you before you ever take it. The era of one-size-fits-all medicine is ended, and gene therapy rewrites the code. Cell therapy rebuilds the hardware. But you cannot fix what you cannot see before it becomes a catastrophe. The third revolution gives us the eyes. Most diseases are not devastating because we lack therapies, just because we find them too late. Timing is the killer, not the disease, but the lateness. AI changed this. We are training models on genomic profiles, medical imaging, continuous biosensor streams, and these models detect patterns that no physician can see. Early Alzheimer's markers, years before the first symptom, precancerous changes invisible to the human eye, or cardiac symptom buried in electrocardiogram. But detection is only the first layer of what AI is doing to medicine. The second layer is drug discovery. AI is not just accelerating the process, it is reinventing it entirely. Discovering a new drug takes almost 12 years, billions of dollars, and a failure rate near to 90%. Why? Because the chemical space is almost infinite. Searching for a right molecule feels like crossing the desert without a map or a compass. The number of potential molecules that could interact with a given target in the body is larger than the number of atoms in the observable universe. No human team, however talented, can navigate that space. AI platforms can cross that desert. They are networks of specialized agents working in parallel. One designs a candidate molecule, another one predicts the 3D structure and affinity, another stimulates the toxicity, and another optimizes the synthesis pathway. They iterate and learn from every failure in real time. A problem that stumped biology for 50 years, like predicting how a protein folds alone from its sequence, was solved in a month with AI. AI platforms are now identifying drug candidates in weeks that would have taken decades to find. We are moving from a world where a chemist tests 200 molecules a year to a world where an AI platform explores 200 million. But these platforms don't replace the scientists. They need the scientists to define the target, to interpret the results, and to ask the right biological question. The bottleneck is now the quality of the question, and asking precise, constrained, high-value question under uncertainty, that's exactly what engineers are trained to do. Step back for a second. What I have described, a single gene injection, a reprogrammed cell, an AI model. None of this look like medicine as we've known it, and that's exactly the point. For 2 centuries, the pharmaceutical premise was built on chronicity, a molecule taken every day for life. The business model depended on it. The clinical system was designed around it. That model kept people alive, but kept them patient. The 3 revolutions represent a rupture of that model. 1 gene therapy administration, 1 CAR-T infusion, an AI model that catches the disease before it writes itself into a body. We are moving irreversibly from a medicine that treats to a medicine that cures. And every assumption the old system was built on, pricing, reimbursement, trial design, manufacturing, distribution, is now broken and need to renew. This is an engineering opportunity. Before I leave you with the opportunity, I want to come back to Long Island, back to this 60 years old on stage. As we build this system, the temptation for engineers is to optimize the metrics, to solve the technical problems. The system we are engineering runs into people who want to see their children grow up, people who want to think clearly at 90, people who want to be present, not just alive. Christian Guardino didn't just want his photoreceptor be repaired. He wanted to stand on a stage and sing. He wanted to look into an audience and to see faces. He wanted to see the snow falling. The human is at the core of the system, not on the side. I became a pharmacist because I believed science could give people back what diseases takes from them. 30 years later, for the first time, tools are here. Gene therapy showed we can fix the source. Cell therapy showed we can rebuild the lost. AI is showing us we can see the future of a disease before it happens and create new drugs. Most of you are trained to solve very hard problems, very complex problems, under uncertainty. I'm telling you, the hardest and the most constrained system ever created is waiting. And for the first time in history, we have the access, the tools, and the data to engineer real solutions. Christian saw the moon. Imagine what comes next. Thank you.